When people say their heart broke after losing someone they loved, that's not just a figure of speech. There's a real, medically documented condition in which intense grief can actually temporarily damage the heart, sometimes severely enough that it looks like a heart attack, even though it's something entirely different. Before we go further, if you appreciate content that explains difficult topics with both compassion and scientific accuracy, go ahead and like this video and subscribe to the channel. My name is Dr. Adrian Vogel. I've spent over 20 years working in cardiology and preventive medicine, and over that time, I've supported patients who developed sudden, frightening heart symptoms in the weeks following a major loss. Symptoms that were real, measurable, and that show just how closely our emotional experience and our heart are actually connected. That's exactly what we're covering today. The medical condition often called Broken-Heart-Syndrome, and why intense grief can sometimes quite literally affect the heart. By the end of this video, I'll show you exactly what happens inside the heart muscle in that moment, a mechanism so unusual that medicine only properly understood it relatively recently. So stay with me, because this knowledge can help you respond correctly in a critical moment, both for yourself and for people close to you. If you're currently grieving the loss of someone or going through a period of intense grief yourself, this video isn't meant to frighten you. It's meant to help you understand what can happen in your body and when it's worth paying attention to warning signs. Let's start with the basics. The medical term for what's commonly called broken heart syndrome is Takotsubo-Kardiomyopathie. It was first described in Japan in the 1990s, and it's named after a traditional octopus trap called a takotsubo, because, on imaging, the heart takes on a strikingly similar shape during this condition. It balloons out at the tip, while the upper portion continues contracting normally, or even more strongly. This condition typically appears after an extreme emotional or physical shock. The death of a loved one is among the most common triggers, but other intense stress events, like a sudden divorce, an accident, or even an overwhelmingly joyful surprise, can also cause it. What all these triggers have in common is a sudden, massive release of stress hormones, particularly adrenaline and noradrenaline. The symptoms are often barely distinguishable from an actual heart attack. Sudden, severe chest pain, shortness of breath, sometimes a feeling of weakness or collapse. That's exactly why people experiencing this usually go straight to the emergency room. And that's the right call, because without proper testing, Takotsubo-Kardiomyopathy can't be distinguished from a classic heart attack. What makes this especially remarkable? In most affected patients, the coronary arteries show no significant blockages or narrowing on examination, exactly what you'd expect to find in a typical heart attack. Yet the heart itself looks clearly altered on ultrasound or during a catheterization. This discrepancy was, for a long time, one of cardiology's biggest puzzles, and it shows very clearly that something different is happening here than a classic blocked artery. And this is exactly where the story gets really interesting. There's a very specific mechanism through which emotional stress directly affects the heart muscle, without any artery needing to be narrowed at all. This mechanism explains not only why the heart can be damaged by extreme grief, but also why most people recover from it completely. That's exactly what I'll show you in the final part of this video. Before we continue, an important note. Everything discussed in this video is for informational purposes only, and does not replace professional medical advice, diagnosis, or treatment. If you or someone around you experiences sudden chest pain or shortness of breath, especially after a distressing event, seek medical help immediately. When in doubt, always call emergency services. Now, back to the science. When the body experiences an extreme stress event, like the loss of a loved one, it releases an unusually large amount of stress hormones in a very short time, primarily adrenaline, but also related substances like noradrenaline. Normally, these hormones help us react quickly in dangerous situations. But at extremely high concentrations, they appear to have a temporary toxic-like effect on heart muscle cells. Researchers believe this massive hormone surge affects the small blood vessels in the heart and may act directly on heart muscle cells, causing certain regions of the heart to temporarily lose their normal pumping function. The tip of the heart is often particularly affected, no longer contracting properly, while the base of the heart frequently works even harder to compensate. This uneven movement is exactly what creates the characteristic ballooning shape that gave the condition its name. Interestingly, Takotsubo-Kardiomyopathie disproportionately affects postmenopausal women. The exact reasons are still being researched, but some scientists suspect a connection to hormonal changes that may influence how sensitive blood vessels are to stress hormones. That doesn't mean younger people or men can't be affected. It simply indicates who carries a somewhat higher risk. The good news, which surprises many people, is that in most patients, heart function recovers completely within days to a few weeks. This clearly distinguishes Takotsubo-Kardiomyopathy from a classic heart attack, where damaged tissue often scars permanently. Still, the condition is by no means harmless in its acute phase. In a small percentage of cases, serious complications can occur, including heart rhythm disturbances or, rarely, heart failure. That's exactly why medical evaluation and monitoring during the acute phase matter so much. What does this mean for people who are currently grieving or experiencing another form of extreme stress? It's not about living in fear or suppressing grief. Grief is a necessary and healthy part of processing loss. It's more about paying attention to your own body, especially in the first days and weeks after a major loss. If physical symptoms like chest pain, shortness of breath, or an irregular heartbeat show up, take them seriously rather than waiting it out for fear of overreacting. And here's the part that shows just how deep this connection between emotion and the heart really runs. There's even evidence that the nervous system, through a direct link between brain and heart, something like a biological hotline, can influence the heart almost instantly, the moment an overwhelming emotional experience is being processed. What exactly makes this connection so special, and why it can alter the heart so dramatically in such a short time, is exactly what we'll look at in the final part. Before we get to the reveal, a question I'm often asked: can you protect yourself from Broken-Heart Syndrome? Complete prevention isn't really possible, since loss and grief aren't things we can or should avoid. What does help? Accepting social support during difficult times, not carrying the burden entirely alone, and being especially attentive if you already have cardiovascular risk factors, since those can further increase individual risk. Now, the reveal. The direct connection I mentioned earlier runs through what's called the autonomic nervous system. More specifically, through an axis linking the brain, adrenal glands, and heart in an extremely fast feedback loop. When the brain processes an overwhelming emotional event, it sends signals to the adrenal glands almost instantly, which then release the stress hormones mentioned earlier into the bloodstream. These hormones reach the heart within seconds via the blood vessels, not hours or days later, but in near real time. What fascinates researchers most is that the heart itself has a high density of receptors for these exact stress hormones, especially at its tip. When these receptors are overstimulated by extremely high hormone concentrations, it appears to temporarily alter how heart muscle cells process calcium, a process that's essential for normal heart contraction. The result? The affected regions of the heart can stop contracting properly for a limited time, even though the cells themselves usually aren't permanently destroyed. This is exactly why heart function fully returns to normal in most patients once hormone levels drop and the tissue recovers. That's the real insight behind a broken heart. It isn't a romantic metaphor, it's a real, measurable biological response in which the connection between brain and heart is so direct that overwhelming emotional pain can actually, temporarily, alter the function of the heart muscle. Here's what to take away from this video. Take grief seriously. Give yourself and others attention during difficult times. Don't ignore physical symptoms after a major loss. And know that seeking medical help in these moments isn't a sign of weakness. It's an important step in keeping yourself safe. If this video showed you something new and valuable, go ahead and like it now. Subscribe to Lebenspulse for more evidence-based health content, and share this video with someone who is currently grieving or supporting someone who is. Feel free to tell us in the comments which city you're watching from. We love hearing from our Lebenspulse community around the world, and we wish everyone currently going through a loss real strength and support. Take care of your heart, in both the literal and the figurative sense.